Board of Annexation.
Board of County Commission, Board of County Commission nine session, we'll begin with, prayer. If you lead us in prayer, Mr. Jones, followed by the pledge.
Heavenly Father, we thank you today for this time you've given us together. Father, we thank you for Franklin County and the people that live in it. We ask you today for wisdom, knowledge, and understanding. God, help us to have the courage to make the decisions that need to be made. We thank you for it today in Jesus' name. Amen.
Allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Yes, next will be approval of minutes.
No move.
We have a motion second on the floor. Any discussion on approval of minutes? All in favor?
Aye.
All opposed? Motion carried. Next item will be payment of county bills.
So moved. Second.
We have a motion second on the floor. All in favor?
Aye.
All opposed? Motion carried. Next will be a Department Director's report. Howard Davis, Superintendent of Public Works.
I don't know if that's like good at this time. Wish y'all Merry Christmas, Happy New Year.
Appreciate everything you done this year, Howard.
You're welcome. Thank y'all.
Anybody have anything?
I would like to ask you something if possible. Todd, if there's sometime this week you can get with me, I'd like to show you something on Moore Street in East Point, see if we can do something about it.
I get up with you
That's fine.
one day next week, probably Wednesday, because we'll be
That's
off
fine.
that Monday, Tuesday.
Not a problem. Thank you.
Any other commissioners have any comments for Mr. Howard? Thank you, Howard. Have a good holidays.
Talk to you.
Next will be, let me get the paperwork here. Next will be Fonda Davis, Solid Waste Director.
Good morning, Commissioner. Don't have anything this morning. Everything's running pretty smooth.
Appreciate everything done this year.
Yeah, thank you. I'll let the crew know, Commissioner. Yeah.
One question, Mr. Chairman, if you don't mind. Are we progressing on another recycling bin site down there at Alligator Point? for the
Yes, ma'am.
people?
I talked with Mr. Paul Parker, and we was moving forward. He said the county owns some property right across from his office, somewhere around the fire station. So we was waiting. They had a meeting. We was gonna wait and see what the outcome.
Okay,
Yeah.
okay, thank you.
Anything else, Mr. Fonda? Have a good holidays.
Same to you all.
Next will be Ms. Pam Brunell, Emergency Management Director.
Good morning, Commissioners. Sorry about the voice. I don't have anything as action item on my report, but I gave these two documents to Michael. Application for disaster assistance, local match reduction or waiver, asking the governor to waive our 12.5%. Don't know that we'll get it, but we need to go ahead and sign it and get it in.
Michael, you got these two items on your report?
Yes,
Okay, I got two items on my report, Commissioners, both. Pam will address better. Item number one, I'll read them both, and you guys can do separate motions for them. Number one is the board action to authorize the chairman's signature on the application for disaster assistance, local match reduction or waiver, and payment deferral for public assistance. And the second item she'll need an board action for is to authorize the chairman's signature on the federally funded public assistance funding agreement. That's, Pam have to explain that to us more. I think that's a FEMA deal.
This is our waiver that we're asking the governor to possibly give us to waive our 12.5%, the county's portion. We've asked it in the past. Other counties that asked for it, we might as well go ahead and get ours in. Don't know that he will give us the waiver for the 12.5%. That what that means is the county wouldn't have to pay their 12.5%. And when you're looking at 12.5% out there at Alligator Point, that's the biggest portion of the money.
So
that the
moved,
county has
Mr.
to pay.
Chairman. Make a motion to approve.
Second.
We have a motion and a second on the floor. Any further discussion? Alan, you got something?
Well, I was going to say, I appreciate the idea and the solicitation of the request.
I'll be honest, it's unlikely we'll get it because the only time we got this was after Hurricane Opal, when the storm came in right before an election. We did get a waiver then. Every county who got affected by Opal got a waiver, but that's the only storm in my career with you all that we ever got a waiver. So we asked for it. But.
Okay, we do have a motion and a second on the floor. Any further discussion? All those in favor? All opposed? The motion carries.
The second item is actually our funding agreement between us and the state and the federal government.
If you want any money, you sign it the way it is.
Yeah.
Because
Can't
that's
change
the way
it.
is.
So moved, Mr. Chairman.
Second.
We have a motion by Commissioner Sanders, second by Commissioner Massey. Any further discussion? All those in favor?
Aye.
All opposed? The motion carries. Any other comments for Ms. Pam from the Commissioner?
Just a question. On your informational item on number 4, you went to Corn Hydro.
Yes, ma'am. Actually, it was a very good exercise.
Was it?
Yes, ma'am.
Did you learn anything?
Yes, I didn't realize that that's only a 6 foot deep lake.
No.
That's what they told us. Anyway,
That
I
may
think
be in that part, but there's parts
it
of that.
made
lake
them
that-
aware that, that there's other people downstream. And,
That's the important thing to do.
and that for them to draw down that lake, they don't need to wait to 3 days before we're gonna have a storm hit us, that they need to start drawing it down way before then, because our actual exercise was, we had Cat 3 hit Franklin County. And, they weren't gonna start drawing the lake down until just a couple of days before it was supposed to make landfall. And me and Scott Nelson's like, no, that won't work for us, because y'all need to understand that we're going to, as that water's coming down, we're gonna have surge pushing back. So it kind of gave them an insight to what it's really like for us here.
Maybe it helps the relationship a little bit better than.
It was a very, very good exercise.
Thank you, Mr. Chairman.
Any other comments from Ms. Burnell?
Have a Merry Christmas.
You too.
Happy holidays, Pam. Next on the agenda would be Mr. Eric Lovestrand, Extension Office Director.
Sign it, get it to Michael, because we got to fill them out.
Morning, Commissioners. I don't have any action items for you, but I did want to give you a brief recap on the Sea Turtle Lighting Grant Project that we work on to manage for the county on your behalf. And during this past year, with the funding that we received through the NERDA funding, we were actually able to finish 47 additional retrofits with Sea Turtle Friendly Lighting out on St. George Island. And we have secured funding for this third year going into that project too. So we're making a lot of good progress on actually changing out lights that are disorientation issues for hatchlings out there. I will try to put together a more detailed summary of some of our year-end numbers that I've been pulling in from my year-end reports for the university. And I will include that in my next report to you all. It will be in the board report. And that'll just give you some details on some of the totals and the impacts that we have with the extension program in the county, so you can look for that next time.
Any comments from the commissioners to Mr. Eric? I would like to welcome his the Northwest District Extension Director, Mr. Pete Forgot, who's here with us today. Thank you for coming,
Yes,
Pete.
I should have probably done that. Pete's here to do my annual appraisal, so he's taking some time just to come over here with me today.
First, right?
I couldn't keep him away, guys, I'm sorry.
Have a good holidays, Eric.
Thank you, appreciate
Yeah,
it.
good holidays.
Okay, next up would be Miss Kristen, I'm gonna leave the last name off, from PanCare, update on the dental clinic.
Good morning. My last name is Gersbacher.
Okay.
My name was Wilson. I might should have kept that. Thank you for having me this morning. I just wanted to introduce myself to you in the community and let you know that our dental clinic here in Carabel is now open. We have a full-time dentist on staff Monday through Friday. And my job with PanCare is I'm the mobile clinic manager. I have a 38-foot RV Winnebago that I take out into rural communities throughout the Panhandle, establish a relationship with person or business to park the bus on a permanent rotating schedule. Currently, we are in Esto, Ebro, Cottondale. We are here. This is our first day of service in Carabel, and we will continue to serve one day a month, as in those other communities as well. I brought everyone a copy of our annual report so you can have a little more insight into who PanCare is. But we are federally qualified healthcare clinics. We operate on a slide scale fee program, so are our dental clinics. And we accept Medicare, Medicaid, and if you don't have anything, there's just a flat fee where we can help you out. And at the end of the day today at noon, I know when your meeting's over, we're going to be holding a ribbon cutting, and I'd like to invite all the commissioners to attend. We'd love to have you and take a tour of the clinic. Also, the medical bus, like I said, is on site today. We'd love for you to get on the bus and see what it is. The bus comes out with a nurse practitioner, a nurse, and a front office person. And we can do anything in that mobile clinic that you can have done at a traditional bricks and mortar office. So it's pretty important to serve those who cannot get to health care, don't have access to health care. We come to you. And Merry Christmas.
Merry Christmas, thank you.
Thank you.
Any comments from the commissioner? Thank you for coming in today.
I appreciate you having me. I'll just stick these over here on the side for y'all.
Next will be Mr. Mike Cooper. Wings report.
Morning, Commissioners. Merry Christmas. Do I need the microphone, or can you all hear me?
We can hear you. I don't know if the people can hear you.
All right. I think you guys have the financials for October and November in front of you. There's not really anything remarkable in there. They're basically break-even months. I think we're showing about if I recall, about $13,000 profit for the 2 months combined, thereabouts. What is interesting is days cash on hand are currently 17, which is very good compared to where we have been. And also, the financials were reflected directly the day after payroll, I believe. So that is another probably 5 days from the payroll that was paid. So our current ratio is 2.6, which means that our current assets are 2.5 times more than our current liabilities. I did want to report that we had another banner month in November as far as collections. It was our highest month yet. We did $470,000 in collections. I've mentioned this before, but prior to this past July, the previous 18 months, we had 1 month over 400,000. We've now exceeded 400,000 July, August, September, October, and November. So collections are doing very well. The problems we were having with the financial package of the computer system have been corrected. As you can see, you have the reports in front of you. Any questions on financials? On EMS, I wanted to introduce our new interim director. Michael Murphy is here. Michael's been doing the interim job for a couple of months. Well, it's been about a month, I guess, now.
Yes,
so he brings a different set of skills than Jared Wester had, but I think the system is in good hands. He'll be flying to Texas, what, the first week?
The truck's pickup is for January 2nd.
So the one truck that we had on order will be picked up on the 2nd. And we do have a resolution in front of you for the mini grant, the EMS mini grant, that I do need action on.
This is a baby grant they call it or whatever?
Baby grant.
Pleasure of the board.
Mr. Chairman, I make a motion that we approve it.
Second.
We have a motion on the floor by Commissioner Sanders, second by Commissioner Massey. Any further discussion? All those in favor? All opposed, that motion carries.
Thank you very much. The next thing on my report is recent conversations with TMH and where we're at with that. I think the last time I was before you, I did mention that we had just had a meeting with Alliant and TMH, and they came to a conceptual agreement on what a joint venture between them might look like. We did meet again on the 9th of December, and I'm happy to say that they came to terms on that agreement, and it's currently being crafted for signatures. The hope is that they will have that done by the 9th of January, and at that time, both Mark O'Brien and the leadership from Alliant would like to address the commissioners directly after that. I think it's the meeting of the 17th of January that you all meet. Now, again, that's all contingent on getting their agreement signed, but that's the plan right now. The last thing on my list is I want to give you some more updated information on Weems East. The prior discussions that we've had regarding East and urgent care and not urgent care, and what the patients that are primary care provider is in Tallahassee, but they're here, needs to be urgent care in order for them to be seen. I did get some additional information on that. As a matter of fact, I got an email about 8:30 this morning that I think is fairly definitive, and it really is up to you on what you want me to do. First of all, if the issues are accepting walk-in patients and extended hours, we can take care of that. It is being taken care of, and we'll implement those two things in January. So that, if we take those issues off the table, okay, I'm going to do that. It's in the process. The other issue that I was made aware of was the well care patient that couldn't get to their primary care. All right. If we start there, licensing of the clinic through the state, you have to get a license. You have two choices. It can be a rural health clinic, or it can be a standalone primary care clinic. And that's the two choices we have. It was initially done as a standalone primary care clinic. That's how it was licensed. From a reimbursement standpoint, that is not the best way to have it licensed. Rural health clinic, we're estimating is about $120,000 in additional, which is what we've been trying to do, is convert these clinics to that licensure. Okay. The urgent care piece is a credentialing piece with the payers. In other words, we have to go to WellCare, we have to go to every one of the managed care programs and actually file an application to be designated as urgent care. If we do that, then the WellCare patient that has a primary care provider can then go there and be seen. The problem is, if we do that, all of our current patients that utilize us as a primary care provider cannot utilize us as the primary care provider. They would go there as an urgent care visit. You can't be both, is basically what they're telling us. You can either be the primary care or you can be the urgent care, but you can't be both. So, and if we're going to be a rural health clinic and get the extra reimbursement, then we can't be an urgent care provider. So that's where we're at with that whole discussion. And it comes down to the commissioners, would you rather us have the designation as urgent care, but then all of our patients wouldn't be able to claim us as primary care provider, and we would lose the $120,000.
Why can't we use one side of it for one side and the other side. You got two sides of the building.
That's actually addressed in there, in the email I got this morning. It can't be the same address.
We can change one side address to the other side address.
It don't work like that.
Well, I mean, theoretically, Commissioner, I'm not saying we can't do that. It
One
will,
on the north side, one on the south side.
it would have, we'd have to get a second license for that site with, we'd have one side of it licensed this way, one side of it licensed this way. We're gonna have two competing sets of regulations that we have to meet. We're gonna have one person doing registration that is gonna have to identify the patient when they walk through the door. Oh, that's gonna be an urgent care patient, or that's gonna be a primary care patient. I'm not saying it can't be done, I'm just saying it would be a mess. But I'm not saying it can't be done, but
I don't know if you're gonna be able to get two addresses for one building. On one parcel of land, I don't think you're gonna be able to do that. I don't think they're gonna give you two addresses.
I have not looked into that possibility. Like I said, I just got this answer at 8:30 this morning, so.
And, Mr. Chairman?
Yes, ma'am.
If you don't mind, let me think on this, Mr. Cooper, because, you know, I'm going back to the language that, you know, I brought up, and that's the reason why we're discussing this. My true concerns are, we need that rural health care designation, health care clinic designation. That's where you get your dollars at. That's why I was looking at that. My main thing is that when we have people go to those doors, I don't want no one, I don't care if it's 5 minutes till 5 or 10 minutes after 8, I don't want nobody turned away. That's my main concern. And it's not so much as the urgent care, I just want to make sure that when somebody, let's say, somebody gets hurt real bad and get in there, well, they're not on the schedule, well, you just have one person in there, the nurse practitioner or whatever, then sometimes they get turned away and they have to go somewhere else, and, you know, what my thing is, I'm trying to make sure that the people are taken care of, and I don't want them turned away, basically.
Well, like I said, that won't happen. I think that was primarily a Dr. Stoll issue. I'm not saying it was always her, but I think it was primarily her.
No, some of this happened before Dr. Stoll and since Dr. Stoll has left. So we just need to work on that better, and I want the people to know, you know, that they can go out there for services, and I want to get the best that they can have, you know? And, but anyway, that's my main concern, and it's like I said, I feel like, and I mean, I'm not in the medical profession, I'm never, you know, I'm not a nurse or a doctor or anything, but to me, it would seem like the rural health care clinic designation would give you more dollars for, you know, the services. And so we're now needing those dollars, so I think that, you know, that would be the best way. But, you know, let's think on it a little bit, and
That's fine.
and give you time to digest that email you got this morning, too.
That'd be fine.
Did you get a hold of the young lady that I sent you, had the number to?
I didn't personally, but Craig has, and let me just explain what happened there. On the issue that you brought up, we had our cleaning person resign at the same time as our backup went into the hospital. So, I mean, our primary and our secondary were gone at the same time. But Craig has contacted that person and another person, and we're trying to get somebody on board.
When did he contact her?
Well, I think he tried that night that we were having the conversation, but it was the next day, I think he tried to get a hold of her. He had been contacting her previously, but had an old phone number. He was leaving messages. We already had her contact information that she was interested in the job, and he had been calling, but it was an old phone number, so.
But it's not only the inside, I know what you're talking about. It's not only the inside the building that needs some maintenance in it, it's the outside of it too. And it has not been well maintained, has not been maintained up to the standard it needs to be maintained, for sure. But that's y'all's business.
Any other comments from Mr. Mike? Did you have another issue you wanted to bring forward? about?
Well, I think the last time I was before you, you had asked for another rendition of the wage analysis, and I did get that to you the Friday after the last meeting that I was at. And I don't know what the disposition is of the commission.
Well, I was the one that brought most of that up, is going back and looking at what we can sustain and going back through all that. And I see you have submitted some stuff. And we got an email from Mr. Morone that you wanted us to address this morning, I believe. We don't have a full board here. That doesn't mean we can address it. I do. Yeah, I know. But it don't mean we can address it, but we normally won't without a full board. I will say that looking at what you presented now is to me, is a lot more sustainable for the hospital. It's a lot lower than what you want. It's a lot lower than what the employees want. But, you know, my contention from the very beginning is if we're going to give a raise, we got to be able to sustain it from. And I see your collections. I will make a comment about the collections over the last 4 months. Have really came up. That's a good thing. That's a good thing for the organization as a whole. So I want to congratulate you on that part of it. It seems like the billing's moving forward, and we're now collecting what we should have been collecting all along. And there's a lot of issues that goes along with that. It's not your fault. It's not this one's fault, but it seems like it's coming together better. So I would like to congratulate you on moving forward, and it seems like everything's coming together as far as collections for the hospital, which is your revenue stream. So I mean, it's a pleasure of the board whether we address this raise stuff this morning. But as I stated, we usually don't address stuff without having a full board here. So I'll leave that up to the board. Whether somebody wants to make a motion to table it to the next meeting when we have a full board, or if they want to address it this morning, that's totally up to the board.
This morning.
That's up to the board. I'm the chairman. I don't make motions in seconds, so.
I'll make a motion that we table this until Commissioner Lockley can be at the meeting, because he's one of the ones that had concerns about the wages too. So I'll put a motion on the board to table it until the next meeting,
Until the next meeting?
first meeting in January.
We have a motion on the floor by Commissioner Sanders to table it until the next meeting, 3rd of January. Do I have a second?
Second.
Second by Commissioner Massey. Any discussion? Commissioner?
I would like to ask something. I know that there are a lot of numbers on those 4 sheets. One thing that concerned me, looking at those 4 sheets, was having people that are still below the minimum for their job. Some of them are EMS people, some of them are still below $10 an hour. I think people that work at the hospital put up with a lot of stuff to not be making $10 an hour. And I'd like to see that be a little different if it were possible. And you got some EMTs still making below $11 an hour. People's lives are literally in their hands, just like everybody else in the hospital. It takes support staff, it takes everybody. That's a concern for me, that's all I'll say.
Well, we can ask him to look into that and bring something back.
I think that would be good.
You would like,
Okay.
so to clarify, you would like to see everybody at least be at the minimum of their salary
I'd like to see those
range?
numbers with everybody, the minimum, yes, or just to look at them, if it's
Could you
possible.
get that to us, Mike, within 2 weeks, so we can address this on the 3rd?
I'll try to. We got Christmas vacations and people are gone mostly next week, so I would definitely try to.
You understand what he's saying, though? He'd like to see
I think
everybody
so.
at least making the minimum in their different categories?
I believe so.
And I'll add that into my motion.
And what would that correspond?
How much money would that transpire to?
Yeah, what that number would be in order to do that?
Yeah, I will see what I can get accomplished. I can't promise that, but I will try.
Okay. Any further comments from Mr. Cooper?
I just want to meet with you before the next meeting.
Okay, all right,
I got some issues I want to discuss with you.
okay,
I'd rather do it me and you.
okay. How about next week?
Yeah, it'll be fine.
All right.
Just sometime figure what day, and you call me and I'll come over, you come over, I want to sit down and talk with you on this.
Okay, that's fine.
Any other comments from Mr. Cooper? Thank you, Mike. Have a good holiday.
Gotta take a vote on the motion.
Oh, we didn't take the vote. I'm sorry. We do have a motion and a second on the floor. All in favor? All opposed? Motion carries. Thank you, Mike.